The problem with us in terms of cost is that because there's so many different segments to care, that seamlessness that we need from, being admitted to hospital and then having somebody in the community to actually monitor what goes on after you're discharged, to getting the rehabilitation that you need. For example, if you've had a stroke, you come into emergency, you get admitted to, for example, my hospital, Universiti Malaya Medical Center. You spend a couple of days getting rehab, and then you're home. There is no GP to monitor your health, unless there's communication and a connectivity there. There is no rehabilitation that you, not that there isn't, but that access and that awareness that you need it. That ability to have it within your community, that community health hub. So I'm really, positive that, with the health white paper, there are efforts to actually trying to provide seamless care. We need to also educate the public that healthcare can be provided in the community, and this is where it is, because a lot of it is not knowing where to go. And a lot of our, especially my older patients, it's like if they are suffering from memory loss, etc., they go through a windy, tortuous journey of every healthcare professional, including some charlatans along the way, before they come to us as memory specialists. And then by that time, it's for us to actually sort of say, okay, I'm sorry, we can't reverse this. A lot of things have happened, but we can actually do A, B, C, and D. But by which time they have spent an enormous amount of money doing alternative therapies, doing investigations in the private sector, which need to be better coordinated and regulated, as well as then coming to a public side when things have gone awry. Public and private healthcare needs to be better coordinated, especially in aged care services. We can do it. We are working to some extent towards it. We are making it a lot more innovative. We've got virtual wards, we've got telemedicine, telehealth that are coming on. So people who can't access care, we can actually try and see them in the home. But for that to happen, we need there to be community stakeholders, private healthcare, to actually try and help coordinate that. And one way in which we can do something about it is so that, if there are these stakeholders and policy makers out there, and politicians, of course, listening in, we do need to actually try and integrate policy, advocate for an integrated policy on aging. Because if it's not integrated, if it's not multi-sectoral, it won't work. We need to actually try and get many people on the table, and for that we can better coordinate our healthy aging from an early age.
Betul, Encik.